Well, this is my presentation on, post-traumatic stress disorder in hospital patients. The problem. PTSD, post-traumatic stress disorder, often called PTSD, is a condition that can be acquired by anyone who lives through or observes a traumatic event or events. It's a condition mostly attributed to soldiers of war. However, PTSD can affect people from all walks of life, including children. List of signs and symptoms. They include avoidance, poor memory, feeling detached, flashbacks, irritability, interrupted sleep, intrusive thoughts, etc. So I'm going to talk a little about my own experience with PTSD. It's a personal topic to me because I was born with a life-threatening heart-lung condition known as tetralogy of Fallot. I've had 8 open heart surgeries and countless other procedures on my body. Experiencing all these things have shaped me as a person, but unfortunately they also did some damage to me psychologically as well. When I was about 2 years old, I had already had 6 open heart surgeries and many heart catheterizations. During my recovery from the 6th surgery, I started to grind my teeth and growl whenever someone in a white coat entered my hospital room. The doctors wanted me to get a neurological evaluation, but my mom insisted that I had been through enough. She also told them that she would take full responsibility for my psychological recovery. Looking back on that experience, it seems like this was my first observable instance of PTSD. Fast forward to 2010, I was 16 years old and needed an 8th surgery on my heart. The operation went well, although it caused a secondary injury that resulted in me not being able to walk. For the next 2 years, I was wheelchair bound some of the time due to an injury of the femoral nerve in my left leg. A few months later, I began to suffer from a heartbeat abnormality known as ventricular tachycardia. My doctors then recommended that I get an intracardiac device, or ICD. They recommended I get it implanted in my chest. This ICD works as a pacemaker and a defibrillator. Between 2007 and 2012, I was in and out of public school. I spent some time being educated through Florida virtual school and hospital homebound. The rest of the time I tried going back to public school, sometimes in a wheelchair. The fall of 2010 and spring 2011, I started to get panic attacks from the fear of my device going off at school. I was also afraid that the device going off would hurt. These panic attacks negatively impacted my life so much that I had to start taking a low-dose antidepressant and leave my public high school to go to a private one. Thankfully, fall 2011, I was able to attend my public high school again and graduate on time spring 2012 with honors. There's no perfect solution to PTSD, but there are many ways to treat it. As I mentioned in my case, I used medication. You can also do individualized therapy or family therapy. There's many options, and oftentimes patients feel multiple therapies, multiple things will work best for them. So you may be thinking, what can I do? You can educate yourself. The National Institute of Mental Health and Mental Health America has great resources on their websites to get yourself educated about this important disorder that affects 7.7 million American adults nationwide. I've also got this other list of resources here: the American Psychiatric Association, American Psychological Association, Anxiety Disorders Association of America, Freedom from Fear, National Alliance on Mental Illness, and National Center for Post-Traumatic Stress Disorder. And obviously there's many more, but this is what I am providing to you. The end.